Hi, this is Dr. Dumestri, board certified plastic surgeon, carrying on with part 2 of my tuberous breast discussion, which is surgery to reshape the tuberous breast. So tuberous breast, constricted breast base, large areola with herniation of the breast gland, droop, and often significant asymmetry. So treatment options can be either just using a breast implant or doing a lift or a combo of the two. So when I'm doing a breast implant for tuberous breast, there are some key differences compared to a classic breast augment. And they really relate to the constriction and to the actual tight bands of fascia, this thick inelastic substance that constrict that whole breast. So when you're doing a breast augment for a tuberous breast, if you're just to simply place the implant, then you look from a side view, it can look really funny, where you have the initial shape and then the second little bubble where there was that tight crease of the tuberous breast. So it's super important to fully release those tight bands. You can even see them like popping open as I release them in order to allow for full expansion of the cavity. I also feel that it's important to do fat transfer for these patients, both injecting liquid fat to the lower pole of the breast where they're deficient, as well as to the cleavage lines and or outer areas of the breast, depending on the pattern of constriction. And then almost always some component of an areolar reduction, which is done either just around the areola as a circular incision, or that classic lollipop anchor incision if they have a little bit more excess skin or excess droop. With those factors and considerations, you can often get a really beautiful, really rounded breast, often in just one stage. Now, say you've got actually enough breast gland, you don't want more volume, you just want them reshaped, then a pure lift can also be done, again, being mindful of those certain differences, like the release that's needed to reshape, and often, again, with the adjunct of fat transfer for aesthetic enhancement. And again, can give you a really beautiful result. So your surgeon will help you to see what will work best for you. There's a whole spectrum of tuberous breast deformity, from a very mild variant to quite severe, and all of them require different tools to achieve that very rounded classic breast shape. Hope that helps. Drop any questions that you may have in the comment section. I'll do my best to answer them. Have a great day.